Hi, we're very honored to have our Dr. Ng for attending AMC today. Everyone is talking about diabetes nowadays. Like, when do I really need to take medication? So if I could control by exercising, control my food, so do I really still need to take medication, doctor? What do you think?
Yeah, thank you for inviting me to this sharing. Definitely, diabetes is a very common problem that is seen especially among the Malaysian population. It is a very complicated matter, but as to just share with you regarding whether or not the question about need of medication, definitely there is a few criteria to diagnose one to have diabetes. If you have been diagnosed that, definitely you need the medication to control and keep the disease in a good condition, so that with addition of other measures such as diet, exercise, and also changes in habits and lifestyle will definitely help to keep the disease management in a good state.
Wow, that's very well explained, Dr. Ng. So since you're talking about being diagnosed, then we should take medication. So how about, if my dad or my mom, uncle, aunties around, their sugar is at a borderline area, say it's like 6, 7, so will we keep with the diet and exercise, or should we proceed with medication? How should we go about?
Okay, so for to diagnose, it is not to just test one time when you are accidentally noted to have a high blood sugar reading. So there are already algorithm and also guidelines on how to actually diagnose you diabetes, in a sense, are you in the normal range, the pre-diabetic range, as well as a diabetic range. So at these three different categories, you have to evaluate your risk. Do you have any other comorbidities, like other health conditions?
So how about the next question? So for example, like I've been diagnosed, so I started medication, but what is the consequences if I've been taking the medication for a very long time? I mean, people are saying once I started, I will take till the end of my life. So any consequences? What will happen to my kidney? That's what people are saying, and that's the concern of the public as well. So what's Dr. Ng's comment on this?
Yeah, like said, the reason to start the medication is very important on what justification this treatment is initiated. If you have very bad control blood sugar level, that means exceeding 11 most of the time, then your risk of organ effect by the high sugar level will be very significant. In that sense, yes, not because of the diabetic medication that actually give you the complication, but it is the high sugar level. Hence, the medication is actually help you to reduce such complications such as towards the eye, the kidney, and blood vessels health. So we have to understand this misconception. So do not be afraid of taking the medication when the benefit is much higher than the side effects. Definitely there are still some side effects, but you can discuss with the doctors on the choice of medication. And regarding lifestyle need of the medication, like said, we should actually pair it with diet and lifestyle modification, so that we can depend less on the medication. We can actually tighter the medication need down. So eventually, I would say you might have a chance to actually keep medication to minimum, or even do not need it after some time, if you manage to optimize the other factors. Yes.
Wow, that's something new. So it doesn't mean that we have to be on medication for a lifetime, We can actually titrate the medication, but of course that will be under the supervision of doctors and advisors from them, so we can slowly titrate our medication. Alright, so I think we have gained a lot from Dr. Ng today. If you have any question or inquiry that you wish to ask us, leave a comment here and we will try to answer it as soon as possible. Alright, thank you.
Bye.
Bye.